Before gynecomastia surgery, we must clearly identify physical exam findings during planning. Excess adipose tissue, excess breast tissue. After identifying these, the patient's test must be evaluated. These are blood and hormonal tests. After identifying these, we can proceed to surgery. This surgery can be performed under general anesthesia or with sedation without general anesthesia. The average surgery time is 1 hour. It can be a maximum of 1.5 hours. In gynecomastia surgery, we can complete this surgery using scarless techniques, and I personally really love applying combined techniques. What we mean by combined technique is this. First, we must remove the excess adipose tissue in the chest area from that region using the liposuction method. Once we have removed the excess fat tissue from the area via liposuction, if any remains, regardless of the quantity, we clearly observe the mammary gland or milk ducts in that area. By the way, do not let any questions linger in your mind. Doctor, why exactly would a man have breast tissue? Biologically speaking, men possess breast tissue and milk glands, just as women do. However, because our hormones are testosterone-dominant, these milk glands and mammary tissues undergo atrophy, shrink and remain small. However, especially in gynecomastia cases, sometimes due to estrogen, sometimes due to drug use, these milk glands and mammary glands can grow, can appear. Therefore, with the combined technique, we first remove the fat tissue. Once removed, we evaluate the remaining mammary glands and milk ducts. If there is a significant excess in the milk glands, then by performing a very small incision at the bottom edge of the colored part around the nipple, remaining there of the glands, we will remove the necessary amount from your body. Why did I specifically say the necessary amount here? In order to prevent any depression in the nipple area, especially to avoid a saucer-like appearance, we must protect a small amount of tissue in that region to obtain a flat surface. Therefore, we will remove as much as necessary from your body, and the result we get will be super. You will have almost no pain after the surgery. You can be discharged the same day, or we can keep you in the hospital for 1 day. After surgery, you will need to wear a compression garment for 3 weeks. You can bathe 2 days after surgery and return to work in 3 to 4 days. You will be able to return to your social life 10 days after the surgery if you wish, which we also recommend. You will start doing sports and your exercises. And as I said, you will use the corset for about 3 weeks. Result will be that you can enter the pool and the sea as you wish in the summer with high self-confidence.